Jen was explaining earlier, we've converted to a point system, so make sure you sign in, get your points, and that'll help you later on when we do officer elections and awards and all that stuff. Right now we have Sergeant Jody Miller from the Air Force, and he is going to talk to us about the Health Professional Scholarship Program and tell you guys how you can get your med school and dental school paid for.
Very cool. Thank you. Thank you for having us here tonight. Like Hannah said, Sergeant Jody Miller, this is Sergeant Purdue, or just Jody or Dewey, however you want to do it. I'm glad this many people showed up. I told Hannah if there's people here that have no interest at all, I mean, please just get up and go. I don't want to bore people that aren't interested. I mean, really, because, it's not for everybody. But basically what I'm going to talk to you about is the Air Force HPSP program. Basically, it's a scholarship program if you're not aware. Throughout our adventures and recruiting, going through North and South Korea, I meet two different types of people that are interested in our program. The first type of person I meet are people that truly want to maybe give something back to their country. They have, an actual belief that, hey, I'm going to serve my country. What better way can I do that than to be a medical officer, practicing medicine and treating people who also have served their country. The second type of person joins our program for, what do you think, what reason? Money. We have a few, I guess, perks as far as money is concerned. Can anyone tell me how much we pay as far as tuition? Yeah. Anyone?
All of it.
100% tuition, that's right. And the great thing about this is there's no cap. So if some of you are applying to a place like, say, John Hopkins or Vandy, and you're out of state, it's very expensive. There's no cap for our program. So we do pay 100% of your tuition, as long as it's an MD school or DO school in the United States or Puerto Rico. We also have another little bonus. We pay really a monthly stipend while you're in med school. The current rate is $19.92 per month while you're in med school, and this should help offset some of the costs that a med student would have. Maybe not cover your entire rent, food, and everything, but it should help out a little bit at least. We also offer all of our applicants currently this year a $20,000 bonus, and this is up front prior to even finishing med school. So if you have undergrad bills, you want to get a new car for med school or whatever, the 20 grand should help out a little bit with that. Does anyone know, have any of you guys done research on any of these programs a little bit? Can anyone tell me what the payback is for a program like this? What's the catch, as they say?
Maybe about 4 to 6 years, depending on your residency.
What do you think?
You have to serve 45 days of active duty a year, and you have to do 1 year plus each year you borrowed in like a medical facility in like the Air Force. So if you do 4 years of medical school, it would be 5 years you have to serve your country.
I was going to say, it's pretty good. Shoot, you guys need me out here. It's a one-for-one swap. I mean, a 4-year med school scholarship, your payback's going to be 4 years. Some of people, figure out they need the money a little late. They might apply for a 3-year scholarship. Of course, the payback would be 3 years. I'm not sure what year that's name. I'm sorry.
Rebecca.
Rebecca brought up a great point of the 45 days active duty. A lot of people get freaked out. They're like, hey, if I'm in med school, I'm in the Air Force program. They can pull me. They can send me to Iraq and all these crazy places. I can assure you, at no point will you ever be messed with, basically, for lack of better words. We're never going to interfere with your medical training. We are here to recruit you as a fully qualified doc, and that is our primary goal, is to get you through med school, to get you through residency, and then have you come on to active duty at that point. You would never be asked to go anywhere, especially if it's going to interrupt school. But we do ask you to do some summer sessions. The first one would be commissioned officer training, which is a 4-week and 3-day course in Alabama. It's usually done the summer prior to med school. So for those who are going to med school next year, it would be either May 25th of this year or July 28th of this year. You get to learn how to be an officer, basically in the Air Force. part of the benefits and one of the great things about our program is not only are you a medical professional, but you're also a commissioned officer for the United States Air Force. And we want you to kind of look like you know you're doing. So for those of you who have no prior knowledge of how the military works, this course is going to teach you how to wear a uniform, all the customs and courtesies, how to salute. Of course, you're going to be saluted quite a bit. There's going to be some physical aspect as far as push-ups, sit-ups, getting you maybe in Air Force shape, I guess you can say. There will be running. Anyway, I used to tell people get kind of freaked out about COD or commissioned officer training. They think it's like boot camp or like Full Metal Jacket. I could, honestly, I think there's a lot of misconceptions about it. Basically, you're going to be down there with doctors, nurses, dentists, lawyers, and chaplains. So it's not really the group of people, we're going to call a dirtbag or make, drop down and give you 50 push-ups and really get in your face type of thing. It's, it's people that we tend to have a little bit harder of a time to attract to come into the military. So we're not going to scare you off with this, war paint type of class. The next summer sessions beyond that, usually between your first and second year, you'll have a summer session which we're going to give you an introduction to flight medicine. Flight medicine is kind of a thing that's, I don't know, maybe special to the Air Force. It's a certain type of practice. Medically, it's like a clinic setting, say maybe family practice, but the patients you're going to see are going to be pilots and their dependents. And the cool thing about it is the Air Force figures, what better way to treat a pilot but to experience flight on your own body. And so flight surgeons or flight medicine guys or girls go up in a plane really once a week as part of their weekly duties. You'd have your regular patient load, and then say on Thursday or Friday or whatever it is, you get to go and get some flight time and experience the G's and all that cool stuff. So that way when your pilot comes in complaining of a certain ache or pain, you kind of have felt that. And so that second summer session is basically where we're kind of dangle a carrot and show you how cool of a job it is and maybe entice you to maybe get into that as far as your specialty is concerned. The third and fourth summer sessions are going to be internships in a Air Force medical facility. And the great thing about those two summer sessions is you kind of get a chance to check out some residencies that maybe you're on the fence about. And so if you're, not quite sure you want to get into peds that summer before you actually do your match, you can test it out for 4 weeks and see if you really like it. Some people, it might be a game changer. So really, those are the basics, of the program. There's so many different, details about it. And I think maybe what's best is, what we found is people usually, when they come up with questions, it brings, ideas to other people. So maybe right now I could just open it up and see if there's any questions out there before I start going on a rant.
Why the Air Force over the Navy and the Army?
With the camera, putting me on the spot.
Show it to the Navy guy.
Especially for people who aren't very familiar with the different military.
Okay, yep. Really, we tend not to really throw stones at the other branches. Of course, there might be some of you out there with a Navy dad or an Army dad or wife or mom. You know what? We all have different missions, really. I think I can safely say that the big difference you can find between us and the other branches is probably the quality of life that you'll see in our installations. I think what I usually do with fresh applicants that come to see us, I kind of challenge them to go look at the other branches, see if they might give you a tour of a base, and I think it would be very apparent the differences just when you walk into the different facilities. I can't really tell you why that is, why the Air Force facilities and the quality of life is so much better. I just know that for 16 years I've been enjoying it quite a bit. Sergeant Purdue has a great story.
I got an idea. I got a little bit of an idea of why maybe ours are better. We are the hardest branch to get into when it comes to getting to the Air Force, whether it be a doctor or an airman coming in as a jet engine mechanic or something like that. So when we entice these kind of people to come in, you know, as recruiters over the past probably 7 or 8 years, I probably put more people in the Army than I have the Air Force just because they weren't qualified and I had to, you know, refer them to another branch of service. So the people that are coming into the Air Force are of a higher caliber, you know, person than say maybe some of the other branches for the most part. So, and the jobs that we do in the Air Force are pretty relatable to the outside. When you're working on airplanes, you can do that in the civilian side. Doctors, computer technicians, finance people, pilots, all that kind of stuff you can do in the civilian world. So sometimes it's very hard for us to keep people in the Air Force because they can get out and maybe make, you know, 6 figures on the outside, where in the Air Force, you know, you're going to make a little bit less, particularly with some of the specialties some of you might be looking at as far as maybe orthopedic surgeons or anesthesiology, things like that. So to try to get these people to stay in the Air Force after their first enlistment, those are the things we have to do to do that, is to have the best facilities we can, to have the best training we can, to have the best technology out there that's available in the Air Force to get people to stay. So it's kind of a quality of life thing. You know, why would I want to get out and give up, you know, a paycheck that I know is coming, and full medical and dental, and you know, 30 days of paid vacation, all this stuff, with the stability of the Air Force, so I can go out and start all over. So that's one of the things I think that we have maybe over some other branches just to get people to stay.
I tell you, I know that's hard to read from now that I think that it's impossible. What? Anyway, the money across the board for all the branches is the same. You're going to get 100% tuition, you're going to get the same stipend, the same bonus. And so the differences are going to be in small things like, you know, maybe our waiting rooms are nicer. I mean, it's just, sometimes it can be so trivial of what one person might think is better than another person. So it's kind of hard. But I think overall, when you ask someone if you were to go to a VA anywhere and tell them what you're planning on doing, tell them you're interested, I'd say more times than not, people that have served, even if they've served in the Army, will probably say, if I could do it over again, I'd go Air Force.
A lot of times it's personal preference too. Some doctors want to be in the thick of it. They want to be in the field where the action is. I'm going to tell you to go to the Army because we can't really do that for you in the Air Force. If you want to be on ships and boats and travel the world that way, I'm going to tell you to go to the Navy because we can't do that for you either. So it has a lot to do with personal preference. A lot of times it has to do with background. I was just talking to a guy a couple weeks ago. His grandfather was in the Navy, went to the Naval Academy. His dad did a 4-year stint way back when, and he just had a lot of ties to the Navy. And because the programs were similar as far as money and things go, he decided to go to the Navy just because he had those kind of ties. So.
Will we have the same patient base as the other branches?
That is a good question. That is honestly probably one I'd have to get back to you guys on. I know your pace of seeing patients in the Air Force is kind of set, so you're not overworked, and it's designed so you can give the best quality of care for your patients. I wouldn't even know the answer to that, to see what the workload would be. I'm sure the Army and the Navy is giving the best quality care to their people as well.
But you don't cross, you don't have Air Force docs and Army people.
Oh no, that's not true. I mean, if we're closest to an Army base, sometimes we can go to an Army facility. He just had his teeth worked on, I think.
Yeah, well, it was actually about 6 years ago. I was home on leave in Nashville, and I had a toothache, and I needed to see a doctor. And the closest base was Fort Campbell. It's like right on the Tennessee-Kentucky border, and so I had to go up there. And I don't know if I was just spoiled with the Air Force, or maybe they were working on building a new facility or something. I don't know. It just wasn't the nicest place I went to. It was like a big bay with partitions, and I was kind of used to a regular dental office and, you know, the chairs and all that. I'm not saying they're all like that. I'm sure, you know, there are newer bases or better bases that have regular facilities, but just with that one, I was a little shocked when I went in to see it. So, but I did see an Army dentist, and he gave me some lecture.